Did you know the position your body is in right now, tonight while you sleep, could be silently protecting your heart or slowly destroying it? One small adjustment, no prescription, no equipment, no cost, and it may reduce your risk of stroke and dangerous blood clots by more than a third. Yet the vast majority of seniors have never once been told about it. Before you go to bed tonight, make sure you are not making this critical mistake. Blood clots do not announce themselves. Strokes do not send warnings. They build quietly, invisibly, night after night, while you lie completely still and completely unaware. Every night, millions of adults over 60 are sleeping in positions that compress their hearts, slow their circulation to a crawl, and silently create the exact conditions blood clots need to form. And not one of their doctors has ever sat them down and explained what their sleeping position is doing to their cardiovascular system while they sleep. But here is what nobody is telling you. One single adjustment to how your body is positioned during those 8 hours could be the most powerful cardiovascular decision you make, and it will cost you nothing. My name is Dr. Ivy Ellington, and what I am about to share with you is something I wish every one of my patients had known 20 years earlier. Stay with me until the end, because the position itself, the complete science behind it, and the exact setup that makes it work, I am going to give you all of it. But only after I show you what is happening inside your body right now, every single night, while you sleep. There is one sleep position that does something most people never expect. It works directly with your heart's natural anatomy, assists your body's circulation, and actively reduces the exact conditions that allow dangerous blood clots to form while you sleep. The entire solution fits in one sentence, but that sentence needs the science behind it, the biology, the mechanics, the data, or you will not believe it enough to act on it tonight. So I need you to stay with me until the end, because the position itself, the complete science, and the exact setup that makes it work, I am going to give you all of it. But only after you understand what is silently happening inside your body every night, and what I kept finding, case after case, file after file, year after year, ultimately forced me to change the way I practice medicine entirely. These were not careless people. These were patients who walked every single morning without fail, patients who took every prescribed medication on schedule, patients who watched their diet, attended every follow-up appointment, and did everything their doctors told them to do. And they were still developing dangerous blood clots, still suffering strokes, still waking up exhausted with swollen legs, foggy minds, and hearts that pounded irregularly in the middle of the night for reasons nobody could adequately explain. The answer was not hiding in their blood work. It was not buried in their diet history or their medication dosage. It was in how they positioned their bodies during the 8 hours every single night when they had absolutely zero conscious control over their cardiovascular system. Once I understood that, I could not unsee it, and I made a decision. Every adult over 60 deserves to know what their sleeping position is doing to their heart, their vessels, and their stroke risk every single night. Now I need to say something directly before we go any further. The pharmaceutical industry profits when you remain on blood thinners for life. The mattress industry profits when you blame your bed, your springs, your foam, anything except the position your body is actually lying in. The sleep supplement industry profits when you believe your problem comes in a bottle. Not one of those industries benefits from you watching this video today. I am not selling anything here. There is no product at the end of this. No supplement, no sponsored recommendation. What I am giving you today costs nothing to implement, requires nothing to purchase immediately, and starts working the very first night you apply it. But here is the uncomfortable truth. This information exists. The research behind it is published, peer-reviewed, and sitting in cardiology journals that your doctor has access to. And yet the vast majority of adults over 60 have never once had this conversation in any clinic, any hospital, or any specialist's office they have ever walked into. That is not an accident. It is an oversight with consequences measured in strokes, in clots, in cardiac events that did not have to happen. That ends today. Here is what is actually happening inside your body every single night. You spend 1/3 of your entire life unconscious. During those hours, your heart beats 60 to 70 times per minute, every minute without pause. Your veins are pushing blood from your legs all the way back up to your heart, against gravity, through vessel walls that after 60 have lost significant tone and flexibility. After 60, your body produces dramatically less nitric oxide, the compound responsible for keeping your arteries relaxed and your blood flowing smoothly. Nitric oxide production drops by nearly half. That is your body's primary vessel-relaxing mechanism, operating at half capacity for 8 consecutive hours every single night. Tighter vessels, slower blood, more resistance. And slow-moving, pooling blood does one dangerous thing above everything else. It clots. Deep vein thrombosis occurs 3 times more frequently in adults over 60. When a clot breaks free, it travels through your veins, into your heart, into your lungs, into the vessels feeding your brain. That is a stroke. Research in the Journal of Clinical Sleep Medicine found 72% of all strokes occur during sleep or within the first 60 minutes of waking. The most dangerous hours of your day are the hours you spend in bed. Now I want you to stop for a moment and answer these honestly. Do you wake up in the morning with ankles that are visibly swollen? Do you feel more exhausted climbing out of bed than you did climbing into it? Do you experience a heaviness in your legs? A deep, dull weight that takes an hour or more to disappear after you stand up? Type yes in the comments right now. Because those are not random symptoms. Those are not simply the price of getting older. Those are not things you simply accept and move past. Those are specific, recognizable signs of circulation that is being compromised during sleep, night after night. Oh, quietly, invisibly, while you rest completely unaware. Do you wake at 2 or 3 in the morning needing the bathroom? Not once, but repeatedly? Do you notice your heart beating irregularly in the dark, rapid and unsettling, for no reason you can identify? Type yes if any of that sounds familiar. You are not alone. Thousands of adults over 60 are experiencing exactly what you are describing right now. And later in this video, I will show you a simple 15-minute pre-sleep routine that begins reversing that overnight pooling from the very first night. The data behind it surprised even me. I want to tell you about Margaret. She is 73, a retired pharmacist from Arizona. Ironically, a woman who spent her entire career dispensing medications to other people. But she came to me after 8 months of waking between 3 and 4 in the morning with her heart racing, rapid, irregular, frightening. Holter monitor, echocardiogram, stress test, full panel blood work. Everything came back within normal range. Her cardiologist said stress. Her GP said reduce caffeine. Her daughter suggested a sleep study. Nobody asked the right question. I asked Margaret one question nobody else had thought to ask. Which side do you sleep on? My right side, she said. Always my right. My whole adult life. I suggested one change. 2 weeks sleeping on her left side instead. Nothing else. No new medication. No new supplement. No new equipment. 4 weeks later, she called my office before I had even sat down at my desk. The palpitations were completely gone. And she was sleeping through the night uninterrupted for the first time in nearly a year. Her morning leg swelling had reduced noticeably within the first week. This was not a miracle. This was anatomy doing exactly what anatomy is supposed to do when you stop working against it. Now I need to show you the 3 sleeping positions that are silently damaging hearts every single night. There is a very real chance you are sleeping in one of them right now. Stomach sleeping is the single most cardiovascularly damaging position for any adult over 60. Your chest cavity compresses directly against the mattress. Your heart is being squeezed from the outside while simultaneously pumping from the inside. A study in the Journal of Applied Physiology found stomach sleeping reduced cardiac output by 23% and increased left ventricle workload by 18%. Every single heartbeat working harder than it needs to for 8 consecutive hours. Over years, that accumulation weakens the heart muscle measurably, and turning your head to breathe compresses the arteries supplying your brain, linked to a 41% increased stroke risk. Flat back sleeping appears neutral. It is not. It causes a 67% increase in sleep apnea events in adults over 60. Every breathing interruption drops blood oxygen, spikes blood pressure, and damages vessel walls. A 2021 New England Journal of Medicine study of 14,000 seniors found flat back sleepers carried a 39% higher cardiovascular event rate. Right side sleeping adds 2 additional dangers. I will explain in just a moment. The damage does not announce itself. It accumulates silently until one morning it does. Everything I have described points in exactly one direction: the aortic curve, the lymphatic drainage mechanics, the venous return pathways, the nitric oxide deficit, the clot formation conditions, the cardiac output data. Every single mechanism I have walked you through, all of it, leads to the same simple, anatomically obvious answer. And the moment I tell you what it is, you are going to feel something interesting. You are not going to feel surprised. You are going to feel like you already knew. Like this is something obvious that was sitting just out of reach the entire time. Sleep on your left side. That is it. That is the position. Left side with the precise elevation setup I am going to walk you through in just a moment. And the reason it works is not complicated. It is not new science. It is written directly into your anatomy, and it has been since before you were born. When you sleep on your left side, gravity works with your heart instead of against it. Your aorta carries blood in the exact direction it naturally curves. Your lymphatic system drains inflammatory waste efficiently. Your venous return improves. Your clot risk drops. a cascade of cardiovascular protection working for you automatically every single night. The research behind left-side sleeping is more compelling than most cardiologists will tell you in a routine appointment. A study in the Journal of the American College of Cardiology found left-side sleeping improved cardiac output efficiency by 17% compared to right-side sleeping. That is the measurable difference between a heart working hard and a heart working smart. Every single night automatically, simply from position, your lymphatic system, or which is responsible for clearing inflammatory waste from your tissues, drains primarily on the left side of your body. When you sleep on your left, that drainage works with gravity. Inflammatory waste clears more efficiently. Less systemic inflammation means less arterial plaque buildup. Lower clot risk, lower stroke risk, a full protective cascade, requiring nothing from you except position. Left-side sleeping also measurably reduces acid reflux episodes overnight. This matters more than most people realize. Chronic reflux irritates the vagus nerve, the nerve directly regulating your heart's electrical rhythm. Protecting that nerve during sleep protects your heart's rhythm while you sleep. An elevation multiplies every single one of these benefits significantly. Research in the journal Hypertension found that adults whose blood pressure failed to drop naturally during sleep, called non-dippers, carried 2.5 times the cardiovascular event risk of those whose pressure dropped normally. Upper body elevation is one of the most powerful ways to restore that natural nighttime dipping without medication. I want to tell you about Gerald. He is 74, a retired engineer from Pennsylvania. For 3 years, his doctor had been managing dangerous nighttime blood pressure spikes with 2 separate medications. His readings were still not adequately controlled despite everything they tried. Dosage adjustments, dietary changes, additional monitoring. Nothing moved the needle consistently. But what Gerald never said out loud when he first walked into my office was that he was afraid. Not in a way men of his generation express easily. He would lie awake some nights watching the ceiling, watching the clock, quietly wondering if tonight was the night something went wrong. His wife had moved to the guest room months earlier because his restlessness was keeping her awake. The house felt quieter than it should have, he told me, heavier somehow. I explained non-dipping. I explained exactly what was happening to his cardiovascular system during those 8 hours. I explained elevation. Gerald went home and elevated his bed using simple, inexpensive bed risers. Nothing else changed initially. 6 weeks later, his average nighttime blood pressure had dropped 19 points. His cardiologist reduced one of his medications entirely. His wife moved back into their bedroom. He said, 3 years of pills, 1 conversation with you. I wish someone had told me this earlier. This was not a miracle. This was physics applied to a human body every single night. Let me give you the complete setup. Every element has a specific purpose. Do not skip any of them. Element 1, upper body elevation. Your entire upper body elevated between 15 and 20 degrees, not just your head, your entire upper body from below the shoulders upward. Use a foam wedge pillow or bed risers placed under the legs of your bed frame at the head end. Do not exceed 25 degrees or you will slide during the night and create lower back strain. Element 2, the knee pillow. Place a firm pillow between your knees. Without it, your top leg pulls your pelvis forward during sleep. compressing the major blood vessels running through your groin and upper thigh. Well, compressed vessels mean reduced blood flow to your entire lower body for 8 consecutive hours. Element 3. Rib cage support. A small pillow or rolled towel positioned under your left rib cage just below the armpit. This removes pressure from your left shoulder and prevents you rolling onto your back during the night. Element 4. Head pillow height. Your pillow must keep your spine in a completely neutral straight line from neck to tailbone. Medium thickness for most people. Test it before sleeping. Straight line, neck to tailbone. That is your correct height. Before you implement this protocol tonight, I need to show you 3 mistakes I see repeatedly that will destroy your results completely, even if you are doing everything else exactly right. Mistake 1. Using regular pillows for elevation. Standard pillows compress within the first hour of sleep. You begin the night elevated and wake up completely flat, with broken, fragmented sleep on top of 0 cardiovascular benefit. Use a proper foam wedge or bed risers placed under your bed frame. They hold their precise angle all night without shifting. Mistake 2. Elevating only your head. Stacking pillows behind your head while your torso remains flat does not create elevation. It creates neck compression. You feel like you are doing something productive, so you stop looking for the real solution. Your entire torso must be elevated from below the shoulders downward. Head-only elevation is not just ineffective. It actively works against you. Mistake 3. Implementing everything simultaneously. Decades of established sleeping habits cannot be replaced overnight without resistance. Your body needs gradual adjustment. Add 1 new element every 3 nights. By 2 weeks, every element feels completely natural, and your body is receiving 8 full hours of cardiovascular support instead of 8 hours of unnecessary compounding strain. Do not let any of these 3 mistakes take this away from you. You do not have to have survived a stroke or a blood clot to understand what Raymond was carrying every single night. You just have to have lain awake in the dark, listening to your own heartbeat, quietly wondering if tonight is the night something goes wrong. If you have ever felt that, even once, you will understand Raymond completely. Raymond is 69, a retired police officer from Georgia. 18 months before coming to see me, he had survived a pulmonary embolism, a clot that had traveled from his leg directly into his lung. He was on blood thinners. He was being monitored carefully. Medically, everything was being managed, but nobody had treated the fear. Every night, Raymond closed his eyes. Some part of him was still listening, still waiting, afraid that the next clot was already forming somewhere he could not feel. His doctors had treated the clot successfully. Nobody had addressed the conditions that helped create it in the first place. I walked him through the complete protocol: left side sleeping, full elevation, correct pillow placement, pre-sleep leg drainage, every single element implemented gradually. 8 weeks later, he came in looking different, lighter somehow. He said, "For the first time since the embolism, I am not afraid to go to sleep." This was not a miracle. This was a body finally receiving the conditions it needed to stop fighting against itself every single night. Before I give you your action plan, I want to say something I mean completely. You are not broken. I know some of you have been told, by doctors, by specialists, perhaps by your own family, that what you are experiencing is simply part of getting older, that the swelling, the fatigue, the palpitations, the disrupted sleep, the heaviness in your legs every single morning, that is just what 70 feels like. That is just the price of the years. That this is something you accept, manage, and quietly endure. I am telling you as clearly as I possibly can. That is not the full truth. Some of what you have accepted as inevitable is mechanical. And mechanical problems have mechanical solutions. Your heart has not given up. Your body has not given up. Right now, at this very moment, it is working with everything it has to keep you here, to keep you moving, to keep you present for the people who need you. It just needs the right conditions to work the way it was always designed to work. You spent decades building the habits that brought you to where you are today. You can build new ones, not because it is easy, but because the alternative, spending another night in a position that strains your heart and silently feeds the conditions for stroke and clot formation, is no longer acceptable to you. Not now that you know. Start tonight, even imperfectly. Left side, pillow between your knees. Upper body slightly elevated, legs drained for 15 minutes before you close your eyes. That is enough to begin. That is enough to start changing what has possibly been happening to your cardiovascular system for years. Now, I have one request. Think of one person in your life right now, someone who takes blood pressure medication, someone who wakes up every morning with swollen legs and does not know why, someone who has had a stroke, a TIA, a blood clot, and never once had this conversation with their doctor. One click. That is all it takes to put this information directly in front of them. You might be giving them something that changes their health in a way nothing else has managed to do. And if you are not yet subscribed, please subscribe right now. This is exactly what I do every single week. Clear, honest, practical cardiovascular information built specifically for adults over 60. No products, no agenda, no sponsored recommendations. Just the science and what it actually means for how you live your life. Every week there is something your doctor has not told you. Subscribe so you do not miss it. Come back in 30 days and tell me in the comments what changed. I will read every single one. Your heart will feel the difference before your mind does. Trust the process. Start tonight.